All righty. Hello, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gatesway to Health. Today, we're talking about concussions and brain atrophy, and I'm joined by my esteemed friend, Kathy. Kathy, you want to say hi to everyone?
Hello, everyone.
Yeah, hello. And it's a Sunday afternoon, and we're talking about this subject. So we'll probably be delving into this more in terms of concussions and the effects it can have on the brain, as well as all the different types of imaging modalities and other tests to substantiate whether somebody's had a concussion or not. So any thoughts, Kathy, before we go into all this?
I think we just delve right in. Why don't you give us a summary of what we're going over today?
Okay, and I'm going to try to do a summary from now on before we go into it, because oftentimes people give us the feedback that maybe it was a little too detailed what we were talking about. So in summary, head injuries are a big deal in today's society. Largely, they've gained more importance with certain national sports organizations acknowledging that there may be long-term effects from head injuries. And with that, now there's become this desire in the scientific literature to try and prove if there are changes in the brain following a head injury or multiple head injuries. So our summary for today is that with new types of brain scans, we are actually seeing that the brain is shrinking in individuals who have had one head injury, several head injuries, who are a little bit younger, as well as individuals decades away from playing impact sports. We're seeing that their brains look different than individuals who have never played those sports. So I think that's an important point for anyone who's concerned about their brain or wants to know more about their brain as they go into playing contact sports, being fully knowledgeable based on the science at this time relative to this discussion. So that's the general overview. Any other thoughts on that, Kathy?
Is that why we're talking about this today? Is that everything you said in the summary, or are there some other reasons why we're delving into this deeper?
I would say we're talking about it because so often patients who have suffered concussions or patients who have played a sports where there are head injuries involved, and later on they're trying to understand why they're still having symptoms. Maybe you are you're taking care of the kids and you just can't remember what you used to, or you're dizzy, or you have headaches, and no one seems to understand why you have these symptoms. That's really the impetus for us doing this video, so that we can bring greater clarity as to what is actually wrong in the brain of somebody who has a concussion. So often patients who suffer concussions go to the emergency room and they're worked up. They may or may not have a brain scan. If they do have a brain scan, in essence, they're told most of the time, you're normal, there's no fracture, there's no bleed, and because of that, you just need to go home and rest. A lot of individuals go home and rest, but they never seem to regain their pre-head injury status. Let me just say, not most, but some individuals go home and never regain their pre-injury status. They're diagnosed with post-concussion syndrome. A lot of doctors don't know what to do with concussions. Point blank, I have a lot of doctor friends who say, wow, you know what to do with concussion. Geez Louise, I get a concussion patient and my eyes just glaze over. So we're trying to bring that information to you, the practical side, the reality of the situation, then also trying to help you understand why you are not recovering. So
Seems like when I bring this up around friends or family, because there's a lot of young people in our family, kids who play sports, and somebody will say, oh, I probably had, half a dozen concussions while I was playing, but nobody ever diagnosed it. I'm like, okay, so I'm asking you, and I think there is pretty much a protocol. Once you're injured on the field or whatever, you come off the field, the coach or trainer or somebody's going to ask you what?
The coach or trainer is probably going to ask you what day it is, where are you, what's your name, what's your birthday. They're just going to ask simple questions such as that. There are different concussion inventory tests. Everybody uses a different one, but one thing I want to interject there, Kathy, is that we do have a close association at Gatesway to Health with one of the best athletic trainers I've ever met in sports medicine, and he would tell me stories where basically he would go over to look at an individual who had suffered a concussion, and he would be shielded by other coaches from getting over there. There is the reality that lots of times
once it's diagnosed, you're not going back in the game, is what you're saying, correct?
That's what I'm saying, yeah. So once you have a concussion,
Okay.
You're not going in the game, and you may not be going back in the game. And just the reality of sports and the dynamics that are still there from the pee-wee to semi-professional, maybe professional levels, that athletes still want to play, maybe coaches still want to play. And even though the organizations may be taking their best steps to ensure player safety, there are still other variables that cannot be controlled for. So that's my answer to that. And hello to everybody who's joining.
I think parents need to be aware of what that protocol is and what questions are being asked if they get the chance to ask those questions, so that they're aware when the kids go home kind of what to look for. Somebody saying, okay, your scan was okay, that's great. But like you said, if you go home and you still persist with symptoms, the parents need to have some sort of an idea of what they're looking for and what to look out for, so that, within the ensuing days, they can get them back in to see someone before. I assume it's like any other injury, that if it's not treated in some way or something done, it's going to get worse.
Yeah, especially if they return back into the game. We had a comment where, commonly they're told, get back in the game, go back to practice. You just need to tough it out and be tough. And that's not necessarily the best thing for a head injury. Certainly there are certain injuries when you're playing sports, you just got to fight through. A head injury is not really one of them that you want to do that.
I wouldn't think so. I saw a 13-year-old girl totally bang the top of her head into wooden bleachers, and the coach said, shake it off. And the mother said, I don't think so. And she took her to the emergency room. And I was sitting on the other side of the gymnasium, and it sounded like somebody had taken a sledgehammer and hit that bleacher. So I applaud the mother, because, hey, coach doesn't always know best, and it's not his kid. And it's not that their future in their hands. The mother was at least respectful enough and had enough responsibility about her to go ahead and grab the child and take him to the emergency room before. So at least they'd know what they were looking at. And yes, there was a concussion.
Exactly. And I think part of the problem, Kathy, is that when so many people, let's say in their 30s onward, have played these contact sports. And we had head injuries, and lots of times those of us in these age brackets become the coaches and say, well, I had head injuries and I'm fine. And so therefore, maybe there's just too much controversy surrounding concussions. Maybe there's too much attention. Maybe we're being too fragile in our handling of these players. But I would readily disagree. I understand where that individual would be coming from, but I readily disagree based on the fact that the current literature is overwhelmingly solid in how one concussion can affect your brain. And what does that mean to your brain function later in life? And what does that mean to a 55-year-old who starts to have behavioral changes and impulse issues and anger issues, things of that nature? This is an issue that we have to pay attention to. So that's why we're talking about it. And hello to everybody who's joining. Just wanted to say that. So that's kind of my take on that.
What does the brain atrophy, or why does the brain atrophy after head injury? What happens in that case?
The thought is just as though if you were to hit your thumb with a hammer, that thumb would swell initially, and then through time the swelling would go away. Well, when the brain swells from a head injury, they're finding that there is this initial swelling of the brain cells, the neurons. Through time, it's thought that swelling actually leads to the neurons burning themselves out. It's called excitotoxic cell death, and then the neurons actually start to shrivel. That is the current concept for why we're seeing the atrophy after head injuries. Does that make sense?
Yes.
Good. Okay.
And it needs to be, again, that recognition has to be there. People have to pay attention to those changes. And I was going to say a minute ago when you said the guy played sports and then he turns around and coaches sports and says, yes, I've had injuries and I'm okay. He's talking about something from maybe when he's 13 or 14 and now he's 35. maybe thinks he's okay.
Right.
And that's his
Right.
perception, because some of this stuff can be pretty gradual over time. Some of it can be very quickly, but sometimes we perceive ourselves as being in a lot better shape than what we actually are. And like you said, when you get to be 55, right, then all of a sudden you start seeing these other things happen.
So true. So true. Yes, indeed. And that's where my perspective, having worked with scores of concussion patients, my perspective is a little bit different. And like you said, Kathy, lots of times we think we're fine, we're not fine. My own individual experience, how many football coaches or hockey coaches or boxing coaches out there have been through a full neurological exam, a functional neurological exam, a video nystagmography exam, which is where we track eye movements? How many of you have had specialized brain imaging? My argument would be probably the minority of you have had all of those tests done. And I know when I went through my workup, I was frankly shocked at the fact that, and so were the doctors examining me, that I couldn't stand up with my feet together and my eyes closed. And I was 25 at that time. And had I had some head injuries? Yeah. Had I had some subconcussive head impacts? Yeah. And why is a 25-year-old not able to stand up with their feet together and their eyes closed? Well, I had some brain trauma. And I probably said it in other discussions. I would slur my words when I was tired, and I just thought I had a big tongue. Well, there's more going on than it's not a big tongue. It was the fact that my brain was not in balance from a concussion standpoint. So yes, just because you think you're fine, you're probably not fine if you've had head injuries. I kind of
think of it when you talk about it as, and for old people, say you're playing a 45 record on a record player and the needle is messed up and it keeps doing those blips on the record.
Yeah.
And that, to me, that's kind of what I'm getting when you're talking about what the brain's doing, because it's going along, and all of a sudden you don't speak properly or whatever. And I think people even see this. I'm seeing it in myself today because I got like 2 hours sleep last night. So if the brain's not firing right, then these are the kind of things that you see. Mm-hmm. And if you've been in a position to have been concussed, then it's definitely something that I think people should be paying attention to.
Absolutely, 100%. And we're even seeing now that there's this acknowledgement of chronic traumatic encephalopathy, which is the relatively newly defined brain condition affecting individuals who have been through a lot of head impacts. That's even been documented in high school football players now, which is really concerning, because we are seeing that a very high percentage of former professional athletes who have been in these contact sports have this entity called chronic traumatic encephalopathy, which affects decision-making, which affects impulse control, which affects memory. Well, it's something we need to pay attention to if we care about our loved ones. And maybe we need to look at this even if somebody's played high school football or high school hockey or high school soccer.
Soccer, they talk about that where they're always hitting the ball with their heads and stuff. That's supposedly, isn't that one of the highest numbers of concussions?
Yeah.
Is soccer?
Soccer is, because those soccer balls are kicked with a lot of force, and it takes a lot of force to encounter that with a headbutt, so to speak. And neck musculature is also really important when it comes to suffering a concussion. That's a really interesting thing. It's like the more muscular your neck is, the less likely you are to have a concussion. That's peculiar. They're even creating new devices now that go around the neck, around the jugular vein, trying to compress the venous flow so that you almost get blood going back into the brain to create a cushion for the brain. That's other technology that's coming out there. So I just go off on these tangents as, I appreciate Kathy bringing this up, because
for me, the metaphor is almost like if that soccer ball's been kicked by a high school or college kid and it's coming at a pretty good velocity, you're going to hit that with your head. It's kind of like a very minor head-on collision with automobiles. I mean, you have this force coming from one direction.
Right.
The head is sitting there taking all of that, and the neck has got to snap. All of that from your forehead clear down into your shoulders is going to be shaken. And again, then you've got the ensuing whatever kind of damage, especially if you play soccer from the time you're 6 years old or whatever, clear up into college, you're going to be enduring quite a bit of that stuff.
Yeah, and as athletes get bigger and faster and stronger, whether they're kicking a soccer ball or it's, a hockey player or it's football, these forces are increasing. And just being a spectator of these sports from when I was young, you can just see the change in the athletes and their bodies and their speed. And, for anybody who says, well, we had concussions back when I was playing in whenever the 70s and we just went back to the game. Well, yeah, that's true. And we know that a lot of those individuals ended up having problems. And now with the forces increasing, what are the problems going to be? Hard to say. So
I think that's one of the reasons I can never watch boxing. So many people like to watch boxing, but when you see that hard punch come through it and that head jerk back you think, his head needs to be on a spring so that he can bring it back in, because you feel like the thing ought to be about a block and a half away by the time that monster delivers that punch.
Yeah.
And, it's one thing if you're hitting a bag in a gym, but to do that to a human skull, it's kind of intense. I know it's a sport that people really, really like and they enjoy, but it's just something I've never really enjoyed watching. And to call a fight if somebody starts bleeding, in the eye or whatever, maybe, but how many other blows have they taken to the head that probably did a lot more damage than that one did? So,
right, absolutely.
What do you think the future implications of all this is?
Future implications are hard to say. I know there's a lot of concern as to whether some of these contact sports are even going to be around in 20 to 40 years, but the future implications for anybody who has suffered a concussion, who has had multiple subconcussive head impacts or multiple concussions, are that we are seeing basically definite changes in the brain in terms of gray matter volume. That's what we're seeing. We're seeing it within 3 months after a head injury. Another study looked at rugby players and compared rugby players to people of the same age, and these rugby players had concussions, and they saw that in essence their memory area was atrophied compared to individuals who had not played rugby. There was some question in that study, was it due to the fact that rugby players drink more alcohol and alcohol can cause some atrophy in that area? Possibly, but they felt that even if you accounted for the alcohol, the head injuries were playing a piece into it. There's another study.
Atrophy.
Atrophy is, Atrophy is shrinking. So the memory area of the brain literally had shrunk compared to people who had not played rugby and had multiple concussions. Another study looking at Canadian Football League football players who were in their 50s, and they compared them to age-matched controls, and they compared them to this data bank at Cambridge University, basically brain scans of what a normal brain should look like for someone who's in their 50s. And I think it was 300 and some odd people in that Cambridge study, and they took all that information, compared them to the Canadian football players who were retired in their early 50s, and they found that the Canadian football players also had atrophy in their memory area. So that in and of itself should raise some eyebrows, should make you pay attention when you're talking to people who are wanting their kids to go into something like boxing. I'm not completely anti these sports, but informed consent needs to be there. If you have a young individual who's not of legal age yet, parents need to know what the repercussions are. It's just like smoking a cigarette. Same thing for an athlete going into a professional sports organization. We're probably going to have informed consent as to, okay, proceed at your own risk. You want to play the sport, you want to make this money, that's great. But no, this is what we know could potentially happen later on. So that's kind of the story at this point in time.
Can you see atrophy in the brain after just one concussion?
Yes.
Do you think? Yes.
I know so. In essence, this was a study was done out of Toronto, Neuroscience Letters 2017. Yeah, Neuroscience Letters 2017. They took around 20 young males and who had a concussion, who went to a level 1 trauma center within the last 3 months, and they compared them to guys of the same age who had never had any head injuries. And they also controlled for, making sure the guys who had concussions weren't taking drugs that would cause brain atrophy or anything like that. And they saw within the 3-month range that if based on their brain scans, the concussion individuals had atrophy in their left superior temporal gyrus, their left postcentral gyrus, as well as their right parahippocampal area. Simply meaning they had atrophy in areas of their brain involving verbal memory, working memory, and spatial memory. Kind of important. So these are symptoms that correlate highly with patients who have concussions. So yes, one concussion can cause atrophy in different areas of the brain.
Okay. And then repeated head traumas, what are we seeing? I mean, I think you just answered that for contributing to brain atrophy for young males. I mean, if one's capable of doing it, then we're going to see, I think it just exacerbates the situation.
Yeah, and that's where they're seeing more of the atrophy in that memory area. That seems to be where the studies are pointing to. And it's interesting. The memory area is a very sensitive area of the brain. The memory area is one of 2 areas in the brain that actually makes new brain cells all the time. Think of them as fertile little brain cells that are sprouting like a little plant. Well, head injuries are one of the worst things for brain cell growth. And in that study from Toronto where they just looked at concussions, one concussion, they were expecting to see changes in the memory area, and they actually didn't after one concussion. I said parahippocampal, which does involve some spatial memory on the right, but it's not the actual hippocampus. But with the repeated head injuries, it seems that the memory area is the selective area to atrophy, based on what we know at this point. Now, is there some research that counters this? Yes. Is this completely definitive? No, but I'm quoting the most recent studies that have taken into account previous studies, and these current 3 studies that I'm mentioning are pretty solid in what they're seeing, that there is atrophy in the memory area with multiple concussions, basically in somebody in their 30s and someone in their 50s, and then also brain changes after one head injury. So,
what about brain trauma earlier in life? How does that affect brain atrophy decades later?
And that's what we don't quite know that yet. I mean, the only thing we can do is extrapolate from the Canadian Football League study, or the Canadian football player study, where they looked at them decades later after they had the head injuries and they saw their memory area was shriveled, or it was less dense, let's say it that way, than it should have been. That's what we can extrapolate. And it's thought that, as I mentioned before, the brain cells swell, and then through time they seem to shrink because it's almost like they burn themselves out because of all of the inflammation.
Do we see any other physical maladies that come along with that? I mean, we talk about we're gonna shrink the memory and a couple other areas in the brain that's going to affect. But does that lead to other debilitation in other parts of the body or in nerves, that sort of stuff?
It does, and that's a good question. So, there has been, let me say it this way. One way for a retired professional athlete to receive disability is to be diagnosed with something like Lou Gehrig's. We just had a very famous football player die of Lou Gehrig's, I think last year, sadly, who was almost a national celebrity. And they are thinking that somehow the brain trauma facilitates other neurodegenerative conditions that may or may not have happened, but we're seeing higher rates of things like Lou Gehrig's disease in former retired head impact sports athletes. So yes.
And this was the player that we talked about who said, and wrote it in his book or whatever, that even given a second chance, he still would have played football and did everything that he did.
Right. And, and that's the informed consent. It's our own life, and that probably delves into some political views, which we won't get into, but some, freedom of choice. That's part of being an American. And, as long as you know the consequences, should somebody be able to proceed at their own risk? And that's kind of the question.
And that's really what we're dealing with today is letting people know the consequences, and that there actually are consequences to these injuries.
Right. And I think this way parents can make a better decision. This is just maybe a personal rant, but, if you have a grandchild, if you have a child, what are the realities of this individual making it to a professional sports organization and making lots of money. If the probabilities are high, fantastic. If the probabilities are low, should that person still be playing these contact sports? That's your decision to make. But that's something to look at realistically based on what we're finding now. Or if they are going to play a contact sport, what can you do for them from an anti-inflammatory standpoint after they've gone through these head injuries to help them later in life, so maybe they don't develop that? Because that's something that really hasn't been looked at, and it's going to be difficult to study, because that could take 10 to 15 years to take a group of retired professional athletes and put them through a program kind of like what we do to reduce inflammation in their body, and they'd have to have strict adherence to it, which is going to require a lot of discipline. But could that make a difference? Because we work with head injury patients all the time where we see these phenomenal changes in someone who was precipitously going downhill due to their head injury, and all of a sudden now they're regaining neurological function, their neurological tests are more normal, all of these different elements. So those are pending questions. We don't have all the answers at this point in time, but Kathy and I will be doing more Facebook Lives on head injuries because I like people to have all the information that's current. And today we're just talking about volumetric. So this volume of gray matter, how dense is it? That's what we're talking about based on MRI scans. There are many other types of imaging modalities. There's other types of MRI scans that are used in the detection of head injuries. And probably tomorrow when I have some assistants here in the office, I'll go through the PowerPoint I put together today, kind of summarizing what Kathy and I are talking about, but I'll show you some of the research articles and the papers and the images so you can get a better grasp of what's going on. And hopefully this will be the first and second of many discussions where we put together kind of PowerPoints like this so you can really better understand visually what we're talking about. So yeah, I think that pretty well summarizes it.
Yep, I think that wraps up pretty much everything we can say about that. But I'd be interested to see what you do tomorrow on the PowerPoint. Okay.
I'm not sure a time. It will probably be around 6-ish Pacific time, most likely, unless you think another time is better, Kathy, and we can kind of go from there.
Whatever works for you.
Okay. So, all right. Any closing thoughts?
Any questions from anybody?
No questions. We just had a lot of people saying hi and joining, and hi to everybody back. And if you do all have questions, I'll try to come back and answer them later on. So that's what we'll do.
Okay.
All right.
Thanks for the information, Dr. Gates.
Absolutely. Thank you, Kathy. Happy Sunday, everyone.
Yep.
Yep. Yes, indeed. I'll end this one, and then I'll end this one.